You know, USGLC often asks the question what it's worth, and I think we just heard 25 million lives. If that doesn't demonstrate the power of what America can do, working together with industry, government officials, NGOs, I don't know what does. So that was an amazing panel. And we're going to continue our global health conversation right now, shifting to reinforcing global health security systems. Dr. David Walton was appointed by President Biden to serve as U.S. Global Malaria Coordinator, joining PMI after serving as the Senior Director of Global Health at the Butterfly Network, Inc., co-founding Build Health International, and 15 years with Partners in Health. He brings over 2 decades of experience working in global health, including working on the ground in Haiti to fight the 2010 cholera outbreak and on the front lines of the 2014 Ebola outbreak in Sierra Leone. Paul Schaper serves as Associate Vice President of Global Pharmaceutical Public Policy at Merck, where he leads global policy efforts on infectious diseases, including antibiotics, antifungals, HIV, and hepatitis. His work has involved HIV prevention and treatment issues for over 3 decades. We are now going to moderating this conversation on our response to other global health threats is USGLC's Executive Director, Jason Gross. Please join me now at welcoming this panel to the stage.
Thank you, Heather. It's an honor to be with Paul and David to build on that remarkable conversation we just heard about PEPFAR. It transformed a continent, transformed how many across the globe viewed America at that time. And now we have a topic that is no less important. Talk about global health security and global health systems, how we prevent and prepare for the next pandemic we know is coming sometime down the road. And yet, we know all of these global health issues and these platforms are deeply interconnected. We know that a rising tide lifts all ships. But conversely, when we see a setback on global HIV/AIDS, we risk a setback on malaria. With a setback in malaria, we have the risk of a setback for neglected tropical diseases. So we see all these things are interconnected, and we know when a virus can cross the world in a matter of hours, we're only protected when we're investing in a wide range of global health platforms to be prepared for, God forbid, the next pandemic. And so we have 2 experts with us today to talk about the threats and the progress we've made, not just to strengthen health systems around the world, but also to protect Americans here at home. So when we start with a question to both of you, and maybe like you, I know that so many of our state leaders came up to me and said, Jason, the one thing I want to talk about today is COVID, the thing that ruined our lives for 2 years. And they really didn't come up and say that, of course. Our memories are all so tortured with that for what happened over the 2 years, the lives that we lost, the livelihoods that were interrupted. But there's no way to take a look at where global health systems are right now without assessing where we stand after the disruption, the great disruptor of COVID. Last month, we saw reports in the midst of COVID that we lost as much as 25 years of progress on global health issues in the first 25 weeks of this disease. Whatever the measure was, we were set back when it happened. And of course, the WHO declared that COVID-19 is no longer a global health emergency. But I think right now, to start off our conversation, first to you, Dr. Walton, to say, where were the worst setbacks that we had in terms of our global health approach that COVID and the pandemic caused? And how is America, how are our allies around the world working to win back the global health gains that we lost?
It's a great question. And I think it's important to understand the complexity of the question you're asking. And in some cases, what I think you saw with COVID is the exposure of the fissures of the system itself all across the world. So I think of it as like you have cracks in the foundation, you put some duct tape over it, you paint over it, it looks beautiful, and then when you get a jostling, those cracks are exposed. And so globally, you saw supply chain issues really disrupted that affected things that you would never expect it to affect, like malaria, like HIV, like NTDs, right? You saw a disruption in somewhat fragile health systems really unable to deliver basic care, primary care, care that is to pregnant women, et cetera. And you saw what I think was certainly a surprise to me, and perhaps others, was the ability of the politicization of science to be able to affect policy in ways in which I don't think we had envisioned pre-pandemic. And so in those issues lies such an incredible opportunity, right? I also think it's important to recognize where things went far better than we ever imagined. When you look at the African continent, I think in the beginning of COVID, people envisioned just disastrous results. And yet you saw health systems traditionally defined as weak, say Liberia, for example, reach vaccination rates of upwards of 90% much faster than where we sit today. And so, I think important to understand, and the cumulative effect of sort of all these setbacks was a global decrease in life expectancy, the first time, I think, in recorded history, at least that we've been making the progress that we've been making. And so when you think about those setbacks, I think the other side of the coin is you've disrupted the system so much. I think we're looking at it in a very different way, understanding that it isn't enough to actually try to reclaim the gains that we made pre-pandemic, we're making, and that we lost during the pandemic, but actually, how do we actually recast our gaze to understand what is possible? Because if we go back to what we were doing pre-pandemic, sure, we're going to continue to make progress, but I think it's a real significant opportunity to accelerate the progress if we take a hard look at what we learned, which is quite significant.
Paul, setbacks, but also some resilience that we saw in this in adjustment to this pandemic.
Well, I think that's right, and I think COVID revealed the fissures in societies. I think we all know that. It showed us what some things that are working, and it also set us back. I think from a setting us back, I mean, it didn't just set us back in global health. It set us back in our health in high income and low and middle income countries. In our own country, we saw an increase in maternal mortality. We saw decreases in childhood vaccination. We saw delays in people getting cancer care, getting cancer screenings, getting all kinds of preventative health care that we now need to address those challenges that creates for us in terms of catching up people and now addressing cancers that could have been caught earlier, catching up in terms of vaccination schedules, catching up in terms of addressing the vaccine hesitancy that we see growing across vaccination because of the politicization of COVID. And really the trust in science. We heard in the last panel talking about science-based interventions, and we really need to rebuild that trust in science. We can see that there were some great successes in COVID. The fact that we were able to bring vaccines so quickly to address COVID, I think that shows the benefit of the decades of investment in creating multiple vaccine platforms. That once you had the plug of the virus, the genes, you could plug it into those systems. We need to look at now. It wasn't good enough just to have vaccines. We needed to have therapeutics. We needed to have diagnostics. And I think we saw that the success that we had in bringing vaccines quickly, we did not have the same success in bringing in a quick manner the therapeutics that we needed to address the pandemic. And so when we look at the 100-day mission that the US government and the UK and others have put forward to think about how will we address pandemics of the future, we need to put in place structures that will help us to bring antivirals that are broadly acting and have those in place before, and with enough data that allows us to bring those quickly. And so as we go and move forward in the response to the pandemic, we need to think about what do we need to put in place to be ready to respond quicker the next time.
Well, that game of catch-up so important that you both brought up too. We talked COVID, we talked HIV/AIDS today, so many other diseases and issues we need to address right now that are preventable, that claim far too many lives. And Dr. Walton, you know so well about the issue of malaria as well. WHO estimates that nearly half the world's population is at risk for malaria, an estimated 250 million cases worldwide. We know that global funding for malaria has plateaued despite continued US support for this. So talk to us right now in disease you know so well, malaria. How has PMI been employing their own innovative approach to this, and how do we get our allies and partners to raise their game to join us in this commitment?
It's a great question, and I think I would tweak one framing, which is that the global funding has plateaued. But it's important to understand the context of the population globally, at least in malaria endemic countries, doubling since 2000, right? With a relatively the funding for malaria hasn't kept up with that population growth. In addition, again, we just talked about COVID, and in fact, COVID, like many other diseases, took a significant setback. So we had been making progress year on year globally with decreases in cases and decreases in deaths. The inflection point of the curve flattened a little bit before COVID, which I'll get back to. But then COVID, we actually had significant reversals, right? So we had higher number of cases and higher number of deaths. Last year, globally, we sort of stayed constant. And so this year, we're hoping to actually reclaim some of those gains. But it's important to recognize, not only are we trying to claw our way back from this sort of acute pandemic period, malaria itself is changing right before our eyes, as it always does, right? You have climate change, right, which is not necessarily a malaria-specific issue, but you see more extreme weather events, right? So you saw Freddie off the coast of Africa. You saw the floods in Pakistan, right? We're not necessarily prospectively, globally thinking about how do we prepare for those, and how do we understand a vector-borne disease vis-a-vis these climate events. We have a new mosquito, right, in Africa anyway, that can carry malaria coming over from Asia to Africa. It's a mosquito that is an Anopheles mosquito, that same sort of type of mosquito that carries malaria, but this mosquito is different because instead of living in the rural environment, it lives in urban environments, or it can. Instead of biting at night, it can bite during the day. And so you have huge cities, Lagos, for example, that when you live in the city, you're a little bit inoculated from malaria because you're just not exposed to some of these mosquitoes. Now you are, right? And then you have the beginnings of resistance to the main medication that we use to treat malaria, artemisinin. And so if you put that all in context, we're in a fragile time. And so I think while the US has continued to express its commitment with incredible bipartisan support in the fight against malaria, the global shortfall for funding just to sort of plateau is about $3.5 billion. And so we're grateful that Congress continues to see the importance of malaria, has increased the appropriation to PMI, and which allows me to talk about some of the positives, right? Which is we have a vaccine that has already been released and another one on the way. This vaccine, the US is one of the major proponents of it. We've been working on this vaccine for the greater part of 30 years, if not longer. It's out. It's in short supply for a variety of reasons, but it's being deployed. We have another vaccine on the way. Vaccines in context with all the other tools that we have to fight against malaria is huge. And then I'm also happy to report that PMI is expanding, right? We're currently in 24 countries in sub-Saharan Africa and 3 in the Mekong We're about to expand to 30 countries total. Those 3 additional countries are in sub-Saharan Africa. And so there is hope on the horizon. It is critical that PMI continues and with our partners within the US government in the fight against malaria, because it's now an increasingly uphill battle. In addition to continuing to highlight that we need additional partners, right? We need the private sector, we need others to step up. We're stepping up, Congress is stepping up. We need our partners, the Global Fund, to step up in ways that are unprecedented, because we are now in an unprecedented period of time within malaria.
I think we may have a couple audience questions too. Let me, to you, Paul, also, funding not keeping up with neglected tropical diseases also, just as they aren't with malaria. Something Merck's been focused on, 15-year partnership with the World Health Organization to enable NTD treatment for more than 600 million school children in 47 countries worldwide. Can you talk about this important work that Merck is doing right now in partnership with USAID and US government to address this neglected part of our global health?
Yeah, thanks, Jason. Well, I think Merck got involved in neglected tropical diseases before neglected tropical diseases were called neglected tropical diseases. And really, I think our signature partnership, the Merck Mectizan donation program, started nearly 40 years ago to address river blindness and elephantiasis. And in that nearly 40 years, it started the first part of that donation, which is a collaboration with WHO, the Task Force for Global Health, and others. The first donation was for 250,000 courses of ivermectin. We talked about science and trust in science. I think ivermectin was the first time that we had to put out a press release during COVID saying, please do not use our product for treating COVID. But it is an incredibly effective medicine against in the NTD space. And so that first donation of 250,000 courses, now, that was in 1988, in 2022, we donated 1.1 billion courses of treatment. And through this program that's now lasted nearly 40 years, we've eliminated river blindness in 4 countries and elephantiasis in 3 countries. And I think it showed a model for how other companies can come and be involved in the NTD space. But to what David said, we need continued investment and continued engagement in this space to bring new innovation. And this is a space that doesn't have really any commercial incentive for companies to be involved. So we really need that partnership. And so Merck is currently working with the Gates Medical Research Institute on a new combination for TB. We're working with the Wellcome Trust and the Walter and Eliza Hall Institute in Australia on a new malaria treatment to address malaria resistance. And we're working with Butantan in Brazil on a dengue vaccine. Congresswoman Ross Layton was here. We now actually see scattered outbreaks of dengue in South Florida. With climate change, we are going to see sort of more and more spread of these tropical diseases. And so we need to have these partnerships to bring these innovations to address them to bear.
So much to address with global health systems. Our time is also drawing a little short, but I do have a couple of questions from the audience. We didn't get to them for the last session, so maybe we can close this session with a couple from our guests today. I see Emily Tavino has one there too, and if we have another one, maybe combine them, and then we can close this really great panel that wish we had more time for, but had to make time for Congresswoman Lee. Please go ahead.
Hello, my name is Aaron Moore, and I lead VHCMB, an international health NGO. I have a question for Paul. I wanted to ask about antimicrobial resistance. I think this is a public health crisis that we don't talk about enough, and it's a big one because it's leading to the death of 1.2 million people per year globally. and it costs the U.S. over $20 billion in additional health costs. So my question for you is, how are you all working to address antimicrobial resistances, and how do we get other stakeholders to likewise prioritize the development of new antibiotics or other ways to address antimicrobial resistances? Thank you.
Thank you, Paul.
Well, thanks for the question, because I think this is the silent pandemic that has been going on for some time, and as you noted, 1.2 million deaths a year. But yet, as I talked about with NTDs not having much of a commercial incentive to develop new products, we face the same challenge with antibiotics and antifungals, even though those are conditions that affect the low-income countries just as much as high-income countries, but the market is broken. And so we need to have a response from government and the private sector in order to continue innovation to bring new antibiotics and antifungals to address resistance. In the US, Senators Bennett and Young have introduced an act called the Pasteur Act that would create a novel incentive model to spur ongoing investment by the private sector in novel antibiotics. It's really critical that legislation move forward. This is without steps taken by governments here in the US, in Japan, in Europe. We face a growing crisis.
Thank you, Paul. One more question. Time for maybe for Dr. Walton for this one.
Afternoon. My name is Lydia Sarson. I'm the Executive Director of Healthy Foods for Healthy Kids, and we are a small nonprofit based in Delaware that teaches students how to grow their own food through plant-based science. My question is for Dr. Walton regarding women and girls. Statistics indicate that women's health has declined globally in 2021, largely due to the COVID-19 pandemic. And my question for you is, as we continue to strengthen health outcomes, how can we ensure that women and girls' issues become key components of funding in our global health programs?
Such a good question for PMI, and I think for all of us. I think women and children and young girls represent a very significantly at-risk group. I think what I'm about to say may smack of irony, but part of the problem is the silos of funding that we have. I represent a silo and proudly lead the PMI. But I think part of the issue is the integration. I'm going to don't worry, I see the time, I'm going to finish quickly. Is the integration and the horizontalization. We need more integration, which is why I'm working with Atul Gawande, for example, closely, and with Ambassador Nkengasong, so that we are sort of approaching these issues less siloed, even though our funding is a bit siloed, and more from an integrated approach. The second thing I would say in closing is, I will go back to your comment, which is sort of the rising tide, we're going to lift all boats. If we can focus on women and girls and make sure they have equitable access and can benefit from all the fruits of science and technology, and they're healthy and thriving, when we reach them, who represent a significantly marginalized group, it's going to benefit everyone, right? Because the ability to reach them then ripples out so that we are clearly investing in systems that can reach everyone. And so as I think about PMI and what we're doing, I think not only about the integration and horizontalization of our approach across different sectors, right? Working with my colleagues and I should say primarily our in-country partners, our governmental partners, and the ministries of health, but also realizing that when we focus on them, we're really helping everyone, but they are the key, right? And so I'd close with that, but I think it's just critically, I just want to acknowledge your question is critically important and something we think about at PMI every day.
Thank you. Please, I want you all to join me in thanking these great conversation on global health. Dr. Walton, Paul, for a defiance and determination to address those issues that we have today. Really great session we had on global health. We're going to take a short break right now. Time to grab some snacks. Don't go far. We're starting in 5 minutes with former Defense Secretary Mark Esper. Thank you all for a great conversation on global health today. Thank you both.